Good afternoon. This is Citi FM and Citi TV. You're welcome to our special COVID-19 coverage. My name is Apnanya Meche Ampedu. Earlier today, there was a press briefing by the Information Minister as well as officials from the Ghana Health Service. They gave an update on Ghana's case count and management and also the positivity rate that has been a subject of discussion. This afternoon, we'll center on that, the highlights from the press conference and some other issues. So do stay with us. And this afternoon, I'm in the studio with two gentlemen from the Citi newsroom, from Citi FM and Citi TV, of course. Godfred Akutubuafo is the head of current affairs, and Bernard Avle, host of the Citi Breakfast Show and The Point of View. Good afternoon to you.
Good afternoon.
Nice having you guys in the studio.
Great to be here.
Let's begin, as usual, with the statistics and what we have in Ghana. There was an update on the website of the Ghana Health Service at dawn.
Took us all by surprise.
Yes. We woke up to the alert and the notification that the figures have increased, and we are a little over 3,000. So, Godfred, let's go through the figures quickly.
Okay.
Let's start from the world, and then when we get to Ghana, we can talk about the issues that came up today.
Okay, then I will not. Normally, these days I like to avoid the global numbers, and just give you updates on what people are doing globally. And today has been a significant day in Africa and around the world. And Bernard, you will understand me in a bit. A lot of important things are happening that could give us information as to what the future holds for the economies especially. So let me start from the African continent, and I will go to Nigeria, where there has been concern, Bernard, over a rise in strange deaths in one state. And so in the state of Jigawa, the authorities are investigating a reported rise in deaths. In fact, 100 people have died in 10 days. And so the Nigerian Medical Association has sent a team there, as well as a World Health Organization official to go and check, because if you've been paying attention to the news, you realize that there was a similar incident in Kano. Now, these deaths have been linked to asthma symptoms and others, asthma, diabetes, and high blood pressure. So they want to get to the bottom of this particular matter.
Are these hospital deaths?
No. These are not hospital deaths. These are just deaths that have happened in the area of Jigawa that they are going to look out for. Now, Uganda has also had a $491 million loan approved by the IMF. You would recall Ghana has had its own approved for, we got ours approved a long time ago. Now, the AU has also spoken on Tanzania's president. Now, according to the AU, the President John Magufuli is wrong on faulty coronavirus test, and the head of the AU body that is coordinating the continent's coronavirus response has rejected the suggestion from Tanzania's president that tests for the virus are faulty. And according to Dr. John Nkegasong, who is the head of the Africa Center for Disease Control and Prevention, he told journalists that the tests that Tanzania and other African countries are using had been validated, and we know that they are performing very, very well. Now, Kenya, interesting one also happening in Kenya is that Kenya has agreed to pay coronavirus quarantine costs. Now, Bernard, what Kenya had been doing was very different from what we had been doing. In Kenya, if you land and they quarantine, you will pay. So if you're in there for a month, you are paying every single day your own cost. We did vice versa. And that led to a lot of frustration because people felt that they were running up cost and they couldn't afford it, so they started running away. Now the government has finally said that they will pay the cost for everybody who is quarantined. So these are some of the things that are making news in Africa. Let's do the world, and there's a lot happening. There's a lot happening. In Italy, they will resume weddings and masses. Yes. Italy announced an hour ago they are going to resume wedding and masses. So they will resume in Italy on May 18 under strict safety measures. The government has announced, and they are saying that this will be done in conditions of maximum safety for the faithful. Now, parish priests will identify the maximum capacity of the church, which can guarantee social distancing during masses. Now, this, I have a feeling, will have a significant impact on the rest of the world, knowing what Italy means to the Catholic Church and all, especially. That's why I said, let's keep an eye out for that one. If we go to China, China's government is saying that all of China is now at low risk for a coronavirus outbreak. So basically what they are saying is that even though the disease is under control, they continue to push ahead with treatment and rehabilitation and management. They still are on the lookout for a resurgence. They don't want it to happen. Now, they have not reported any new coronavirus deaths in 22 days, and no domestic transmission case has been reported in 4 days. Also important to note, the UK is likely to drop a stay-at-home message this weekend, according to reports that are coming in. Now, the measures are still being debated and nothing is finalized, but it is likely that this weekend we will see a change in that. Now, they are saying that these changes will include allowing Britons to expand their social groups. Now, everybody knows Britain has the second highest death toll from the virus after the US. Now, they say that shops, including hardware stores or garden centers, mostly outdoor stores, will probably also be allowed to open. But pubs, cafes, restaurants, and department stores are not expected to reopen for the foreseeable future. Now, Sweden is another country. Now, more than 3,000 people have died in Sweden. But Sweden is still on move because Sweden adopted a very different regime from what the rest of the world did.
They didn't do a lockdown.
No.
Yes, basically. So they
don't believe in lockdown.
They don't believe in a lockdown. Now, they've been criticized heavily for this, but the nation's chief epidemiologist actually granted an interview a day or two ago online just to answer questions from journalists on why Sweden went the way it did. So in total, the country has recorded 24,623 COVID-19 cases with 3,040 deaths, but they are saying no lockdown there. The football is back in Germany. Everybody is happy. Now, in Pakistan as well, one of the countries that was hardest hit early on, Bernard, they are also lifting lockdown measures on Saturday. And according to Prime Minister Imran Khan, he says that he does not know when Pakistan will reach its peak, but the people of the country cannot continue to suffer economically. So they are going to go ahead and do what they need to do. And the coach also says that we haven't reached the kind of peak that Europe has seen. Much wealthier nations than us have fared worse than us. And according to them, once their death toll is not as high and their health system has not been overwhelmed, they are going to open up the country. One final global headline from me. But yesterday you did a show on vaccines, and prior to us coming on air, that show was played back. On point of view, you recall a company called Moderna. Now, Moderna was one of the first companies
even though they had never done anything a vaccine
that had been approved by the FDA
in their history.
Now they have a vaccine called mRNA-1273. Now, Bernard, the news is that they have been asked to proceed to a phase 2 of the study, and that was released today. So that drug is going to a phase 2, and Moderna says that it is finalizing protocols for a phase 3, which will begin in early summer.
Well, it's good news. It's great news, because yesterday on our show, we told that the average time it takes to do a vaccine is 10 years, but the truth is that because of global attention, it could be shorter. So if they are successful, and to be fair, the only time we can know we are at the other side of COVID-19 is if we have an effective vaccine, which means that we'll vaccinate a large portion of the population, so the risk is no longer there, or we have a treatment that's effective and affordable. So it's good news.
Well, let's look at the updates we have on the Ghana Health Service side, especially the regional distribution of the figures.
Okay, thank you. I had wanted to give you a quick comment on the global thing he said. So, I'm always very careful when we are told what is happening in Europe and what it means for us. And I'm going to give you 3 reasons for this. Sub-Saharan Africa is very unique because in Italy, Spain, and all these places that a lot of people are dying, averagely 20% of the population is older than 65.
Yeah.
In Sub-Saharan Africa, only 3% of our population is older than 65, right? And that's why the age breakdown, Dr. What's his name? Kuma Abuaji gave is very important.
Yeah.
That we have somebody below 15 who's died, but that's one person. A couple between 15 and 29, and majority higher than that
between
age.
25 and then 39 too.
Good. Now, there's reason to believe that Sub-Saharan Africa will not go through the same number of deaths that Europe and America are going through for the reasons I'm giving. That only 3% of our population is above 65. That doesn't mean only above 65s die, but it just means that younger people tend to survive better than older people, right? So that's number one. Number two, the disease came here last, in a sense that started in China, went to Europe, and it came here. So the time we started implementing our lockdowns, we hadn't gotten to the number of cases that these other people started doing their lockdowns. When we started doing our measures in the middle of March, our case count was nowhere near what was in Europe. So it looks like Sub-Saharan African countries had a head start. For example, Uganda suspended public gatherings before they got a first documented case. Nigeria began screening passengers at airports 1 month before their first case was detected. So even though Africa's health systems are not strong, we had a head start, which is important to remember. Number three, that doesn't mean that we will still not go through a curve, because as I've said, diseases are not randomly occurring. Public epidemics or epidemics and pandemics are not random, as in they follow a pattern. You start, you accelerate, you peak, you decelerate. So even though we may not go through the same height or the same length, we'll go through the same shape. Basic. Now the other point is that because of poor testing and lack of testing capacity, we have fewer cases recorded here. Now let me give you something. The basic COVID-19 case fatality is 0.667. Okay, if you look at the number of people who have died in Africa from COVID-19 as of April, the last week of April, April 23, you have 1,247 Africans have died. Okay, if you use the average case fatality, then it means that the number of cases you have should be about 1.6 million, but only 200,000 cases were there. So my point is that it's very clear that there are more COVID-19 cases in Africa than tests have shown. If you use the average expected fatality of COVID-19 and you run that against the number of people who have died, and you can just project and say, so if a 0.667 case fatality is to be observed and you have 1,247 people who have died on the continent, it means that 200,000 figure of cases is too small. Okay, so these are just the nuances you need on Africa. Having said that, it's great to know that Germany is opening football 15th or 16th May, and all these things happening, so we can learn a lot. Now let's come to what we're told in Ghana. 3,091 cases, right? Initially we were at around 2,000 and something, so this jump was about 300. We're around 2,000 and I'll give you the exact figure.
2,700.
700. Of course, Greater Accra is still the percent at 2,500. Ashanti 165, Eastern 95, Western North 56. Western North is interesting. Western North last week was around 2. It was one of the regions 2 weeks ago that had no case. But they are saying that the 50 or so are from one particular place, possibly a mine or a place where
spoke about a company.
Exactly. Volta region jumped from 16 to 30 in the previous 2 announcements, remained at 30. OT 23, Upper West 19, Northern 13, Northeast 2. So the key headlines for the regional distribution: Western North region, key headline there. The other general headline is that the Northern, Upper East and Upper West, which seem to have had a head start in having more earlier cases than a lot of the regions below, their cases don't seem to rise in that much. So Upper West 19 has stayed that way for a while. North region 13. Don't forget, North region was the 3rd region we got cases. With the initial 11, they are 13. That must be quite impressive. Northeast, the 2 is still the same. And then the other story is that Bono region, for a long time, Savannah and the 3 Bono regions had no cases. Bono region now has 1 case, and the news is that some people are panicking and things like this. So Accra is decidedly the epicenter, and the breakdown was given. I don't have those details here, it's on the website, but it's very clear that those of us in this city have a bigger responsibility to observe all the rules that are being announced. So, in a nutshell, this is the Ghana situation. We can go into the numbers and the breakdown. I'm sure you asked those questions.
Yes,
and then you have 303 recoveries quickly. So, again, somehow our recovery rate is always 10% for some reason. So, 3,091 cases, 303 recoveries. For the first time in a few announcements, the death rate hasn't increased. In fact, the two previous announcements, the death was 18, it's still 18. The recovery, there was an interesting point Dr. Kuma Abuaji made about the recoveries that I was a bit worried about. He said, look, Ghana's recovery methodology, the WHO has two. One recovery methodology is to say you need 2 consecutive negatives 24 hours apart. The other one is 14 days of no symptoms. He says we've chosen the higher bar, which is why our recoveries are not as high as others. And I've shown you this before. If you go on the dashboard, for our peers, our recovery seems to be the lowest. Yeah. He said something that worried me. He said, if we decide for only 1 negative to qualify for a recovery, the number will go up. And I'm asking myself, why would you want to do that? Why do you want to change the rules in the middle of the game? Do you get me? For now, we understand that our recoveries are more rigorous than our peers. So why don't you leave it like that? Why do you want to change it because people are saying the recovery is low? Do you follow me? So 303 is exactly 10%, which is not as good as most of our peers, but he's explained that most of our peers are not using these 2 negative tests for 24 hours. We understand that. Keep it that way so that we know that people actually are negative. Don't unleash partial negatives into the system so that we can relapse. Because you see, the thing about relapse is that Singapore and other countries have shown us that when you take your eye off the ball, things can change very quickly. All right. So that's,
At the previous updates, one of the things that came up was Ghana reaching its peak of infections. And today, we had some better explanation as to why the statement was made. The Director General of the Ghana Health Service is Dr. Patrick Kuma Abuaji. And he said that we reached our peak on April 27, and the cases are beginning to decline. But we can only maintain that if we adhere strictly to all the preventive measures we have been told of. Let's take a look at this video.
We have been looking at, we wish we were able to get cases every day and be able to report on the positivity. But we also have the opportunity to go back and take samples and to see where the day that the samples were taken, how many were positive, which actually gives us something similar to if we had done it in real time. If you look at that data, we peaked around the 27th of April this year. And since then, the numbers have continued to come down till the last presented, that is yesterday. So that is showing that of the positivity, since the peaking on the 27th of April, we have consistently recorded a decline until today, and we hope that will continue to be the case so that we'll be able to nip it, these cases, bring it under control, not actually control.
So that's Dr. Patrick Kuma Abuaji, the Ghana Health Service boss. Godfred, he makes mention of the fact that these are figures from the backlog. So then it raises the question, if they are backlog figures, can we still say we reached our peak?
My question, for him born out of all this was a question of dates. I'm very interested in dates and what we got on which dates. Unfortunately, it becomes very difficult to do that. But from the press conference, they told us that they are now going back to try and attach specific dates to every sample.
Yeah. No, I actually think if you listen to Bedu Sarko there in the next voice clip, he explains part of what Abena is asking and clarifies it. Okay. So maybe if you have Bedu Sarko, let's just listen.
Okay, then let's pick Bedu Sarko there and put it into better perspective.
Because I have two questions.
So Dr. Bedu Sarko there is the head of public health at the Ghana Health Service.
Yes.
For us as a country, which is very creditworthy, and a lot of countries are indeed calling to emulate how we are going as a small country with such an achievement. this is our story to say as Ghana. We are testing people as early as possible, not waiting for them to develop signs and symptoms. And as soon as we identify them as contacts, we take samples, send to the lab, and then know the status. So that is the status that we have. Clearly, you can see that the first sample taken on the 10th of March, the results came on the 12th. That's not shown here because you are not showing when you had the results. You are showing the first 2 cases, sample taken 10th of March, and they became positive. There was a build up till getting to the end of April, and then we have been coming down gradually. That is what we meant we picked. This is not saying that Ghana is off the hook yet. The odds are not over, and the woes are not off. To sustain this and further come down, we need to adhere to all the various preventive etiquettes that have been spelled out quite a number of times.
All right, so that's the explanation we have.
That was part of the explanation. So let me just explain what it says. So the point he's making is that up until now, when we say that we have this number of cases, we do not know whether the cases resulted from a particular day. Okay, so for example, before this announcement, before this new 3,000 and figure, the new number of cases was 550. That 550 could not have been said to have occurred between May 1 and May 2, because even though the result was released between May 1 and May 2, the samples were taken in different days. So it doesn't give you a right picture of new infections. So what they have done is that they have decided that they are going to give you the number of positives based on the day the sample was taken. What does that mean? The results, so when it says the 25th is your highest day, what he's saying is that the results that came from the samples taken on the 25th
of April, okay,
which is why your highest jump was on May 2nd or 1st. Do you follow me? Yes. So he's saying that now you can know that your 25th April, that day samples produced the highest raw number of positives. Okay, that solves a problem, but that doesn't solve every problem. That solves the statistician's problem, because the statistician was saying that the trend of your graph, based on all our projections, you haven't reached your peak based on that graph. Now, he has explained that I'm just giving you the raw number of positives for samples taken on that day. What he doesn't tell you is that, is he taking the same number of samples every day?
That is the question I wanted to ask.
Good. So that's to say, the statistics do what they are supposed to do. They don't answer every question. So what he's telling you is that based on everyday samples taken, the 25th of April's results give us the highest number of positives. So the second question that Godfred will ask is, okay, is there a correlation between your positive and your sample size? Right? So that maybe that 500 you got on 25th was because you took 5,000 samples. That question has not been answered. But what we know is that Noguchi have cleared their backlog. So going forward, we are going to be having a better approximation of sample and positive. That's point number 2.
But hold on, Bernard, before you move on, even looking at that, can I then ask that, for instance, could it also be how many samples were collected that day? Is it that the samples that gave us the peak, as we are saying, has there been another period where we collected more samples than we did on that day?
You see, what you're asking is a classic difference between a histogram and then a normal distribution or a graph that shows a trend. Now, basic statistics, if you start with a histogram, if you don't want to make the error of skewed data, which is what you are looking at, you do something they call moving average. Okay? So what does it mean? On 25th, you got 500 positives. You are saying that maybe because you took too much of a high sample. So our curve should not be just a histogram or a point-to-point graph. Our curve should be smoothened. How do you smoothen the curve? You can do many things. You can decide to say, okay, don't take the average of 25th, take 2 days, 24th and 23rd, take 26th and 27th, and average the 5 for each one. Do you know what I'm saying? That's what we call a moving average. Then you will know whether you're actually trending upwards or downwards. So that's why Kojo Ponkuma tried to say that let's not confuse the issue. He's just telling you that having now known when the day the sample was taken, the day with the biggest positives from our sample was 25th. That doesn't necessarily mean that if we had a normal distribution curve, we've peaked. That's why he said to you that after what we've said, if we don't behave well and we still, for example, the number of samples they take can increase tomorrow because there's all kinds of people who've gone out again and we've seen many more contacts, and the fact that you take a bigger sample pool. So you see, what I'm saying is that you can't use just a normal, what do you call it, a normal raw positive to conclude on infection rate, because rate is different from raw score. But what it tells you is that in terms of everyday samples taken, the highest positives was that day. Interpret it to mean what it is. That doesn't mean that the rate of infection necessarily is coming down.
So this doesn't do it for you, Bernard. No, when it talks when they are talking about our peaking and what we have.
This better
doesn't work.
You see, don't forget that
we've moved from a certain point to now.
Sarkodie's claim that we had gotten to our peak was occasioned by a question. This Tuesday, when they did a press conference, the main headline that they brought was that our backlog has been cleared.
Yeah.
Then a journalist goes to ask about where we are on our curve. Then he says he thinks we have peaked. He's explained to you why he says he thinks we have peaked on the basis of, if you now take test results per day sample is taken, this is our highest. And I'm saying that that is useful for certain kinds of analysis. Whether that means that your curve has actually peaked, it depends on what curve you are looking at. Do you know what I'm saying? And I think there are different curves. So for example, there are certain curves, there's a curve that you use to measure your R naught or your effective R, which is the average number of people each person is infecting.
Okay.
All the countries Godfred mentioned, that curve comes this way. It's coming down. As soon as it goes below 1, you can open up. Okay? If I am making a decision as a president, I may say, Bidu, I like your histogram. I want you to smoothen it for me. I want to see our normal distribution curve, and I also want to see our R naught curve to make a comprehensive decision. Because you see, somebody can say that even though the highest positive occurred on 25th, if you calculate crudely our R, which is what is R? R is how many people is each person infected. How do you calculate that? I can give you a simple way. Your routine or general surveillance are people who show symptoms and go to hospital. They are 919 or something. Your enhanced contact tracing are the people you suspect they have infected. So you can take the ratio of the people who you get from your enhanced contact tracing from the people who you basically show themselves at the hospital. If you do that calculation, which I have done, your R, effective R, is actually going up. Do you follow me? Your R could, because your R started at 1.42, it went to 1.65, which is basically just dividing the number of positives from general surveillance. But you take the number of positives from enhanced contact tracing and divide it. Because general surveillance are those who fall sick and show. Enhanced contact tracing are the people you say they did not fall sick, but because Godfred met them, you are going to test them. So for every one person in the first group, how many people are they infecting? Okay. That's the ratio. So if the ratio is 1, it means that Godfred is affecting one person. It means that your disease is going flat. If the ratio is below 1, it means that Godfred is affecting less than one person, and a human being cannot be half. It means your disease is coming down. If the number is above 1, it means Godfred is affecting more than one person, so the disease is going up. So I'm saying that you don't use just a histogram to determine your general epidemiological status, but it's a useful information he's giving us. That's why they kept saying that doesn't mean we are out of the woods yet. Because if they said that, they'll be kicking themselves in the foot.
Oh, of course. That has always been a given, because every country that says it has reached its peak always adds what there is to add. You understand? But for me, my base, and Bernard has done a good job answering both of those questions. But are they certain in answering the questions that is the day that when new cases actually reached their highest level?
When you say new cases,
in terms of, because that is what your peak is.
Not backlog.
Yes, in open friendly terms, when your new cases reach their highest level, it's your peak. Now, post that, I'm asking, Bernard also raised that particular concern. if we were testing 1,800 a day,
yes,
are we going to continue testing 1,800 a day? On the matter of routine surveillance, which is when
somebody feels unwell and goes
to the hospital, as compared to you actually going there. That is why we were interested in, for instance, the Ashanti Regis planned
mass testing for drivers and market women.
See where that point is. That is why I wasn't expecting to hear we have hit our peak at this period. That has been
we have hit a kind of peak. Because
you can't hit a kind of peak.
I'm saying that, you see,
it's like you ask for a peak. I'm giving you a peak.
For me, this is what I've decided. What they show me means something. It doesn't mean something else.
Okay.
Certainly.
So I'm not going to sit here thinking that because the highest number of positives came on 25th, it means that on 27 and 28, more people are not getting infected. But at least I know that on the basis of the results they got within at least a 3-week window, that day was our highest. That's issue number one. Now, we've seen peaks before that have been false peaks.
Yeah.
Do you understand me?
Certainly.
So it's possible we can go. That's why I said you could have done what is called you use a 5-day moving average. Simple moving. That's what I'm saying. Basically, don't just take 25th. Average it out. 2 days before, 2 days after. That's a 5-day moving average. Then you can see a trend. I don't know if he did that. The thing he showed us, which I think they can show, was a point-to-point graph. It was essentially saying, on this day, this was a number. On that day, this was a number. It doesn't really become a curve until you smoothen it.
You know, and the variability of it.
Good. That's the first point. And I'm saying number two. Reaching a peak is not the only thing you use to determine your response, because these arguments are academic. The main thing the president wants to know is that, are we winning the fight against COVID-19? And WHO is very clear. Are transmissions increasing? How do you know if transmissions are increasing? Infection rate, or incidence, the new cases every day. Now, the fact that he's got 500, you see, rate is not a number. It's a number, but not a raw number. Do you understand? So if you say I got 500 today, and yesterday I got 400, a rate is how fast is the thing changing. Okay? That's why you have slopes. So if you say rate is not just we got 500 today, it was the highest on the chart. So we've slow, it's the pace at which you are moving. So you need more information. But you see, he can confidently say he's reached a peak because he's cleared his backlog. So he may never have to get a large sample anymore between now and whenever. So he probably is going to take a sample of 2,000. And if you look at the positivity rate, it's not possible that he'll get in a single day more than 500 positives. Okay? So he could do that, and he will be right. Now, whether that gives him the insight he needs about the infection in the disease is not clear. That's why we don't just use one method. So you can say, yes, 500 is the highest, but what is your reproductive number? Your reproductive number, I've said it many times, I'll say it again. There are two types.
I don't understand
your basic reproductive number. And in fact, you can ask, Kojo asked the question. He actually bungled the question. Yeah. And the man answered it. He said, Kojo asked him, what is your basic reproductive number? Kojo Oponkruma explained it to him that, Kojo, you are not explaining it at all. And the man said, it's between 1.9 and 2.1. And some people get 2.5. Now, I was asking myself, is this man talking about basic reproductive number or effective reproductive number? Basic reproductive number is the number of people Abna will infect if we don't do anything. Effective reproductive number is the number of people Abna will infect if we impose lockdown, closed border, social distancing.
And these are two different scenarios.
Now, the answer the man gave was that there are figures between 1.9 and 2, which means by his own admission, you are not winning, because you cannot say you've won against the virus if your basic or your effective reproductive number, your effect is not below 1. Do you understand me? Because that's one measure of knowing if the disease is under control. Because once one person is affecting 1.9 people, it means the transmission is going up. So that's what I'm saying, that yes, he's peaked on his histogram, but his answer he gave you on the reproductive number tells you that you are not out of the woods yet. So you need to wait till that reproductive number goes below 1. Then you can say that the rate of infection is reducing. Then you can open the country up.
Godfred, I'm getting the sense that maybe it was too early hearing this from the health service.
Not necessarily. They have a set of data. People have been asking questions. and so they put the data out and explain what the data means. It does not mean we cannot also have questions, but it is their job to put out the information that they have. Unfortunately, the difficulty is that there are a lot of variables around this, and if you heard, I think Dr. Kumar Bwajile, he explained that, look, there are so many models for this, and every country has what it is measuring. You know, so what measure is the most important at a point? Okay, they've given us the number as it is. It doesn't go in isolation. The message is, if we do not do A, B, C, D, you will have new peaks. Okay, so for me, in order to assess that, does that mean we increase the testing that we do to find out A, B, C, D? Because, Bernard, correct me if I'm wrong, for those who chase the peak, they will tell you that you must follow it for 2 weeks to see if indeed. So I ask myself, okay, is it that when we hit the peak, that's why I asked the question, the number of tests as relative to the numbers. So if on that day, we are testing 100, do we keep on testing just 100, 100, 100? Or do we keep looking for maybe 5,000 and find out what is the infection rate amongst that 5,000? And then we can move from there.
That is the point this is important. We've also been studying the rate of increase in the samples since April 19. And we are a bit concerned about the flattening of the sample size. The growth in the samples from April 19 to 22nd, 25th was quite high.
Yeah.
Getting to the end of April, the increase in the new samples was flattening. Now, if you are doing enhanced contact tracing, and you are assuming that you have a reproductive number of even 2, it means that for each one person who is infected, you probably need to test 4 or 6 people. Do you get my point? So, if your new samples that you are bringing in are not growing that much, why? Can that then introduce some skew into why on a specific date your increase was that small? Do you follow me? So the question could be offered as a very fundamental question about that 500, what was the sample you took? Because there's a correlation between your positives and your sample size on the basis of your own positivity rate. The other point that is very interesting is that if you take the general surveillance and the enhanced contact tracing as separate rows, and you calculate their own positivity rate from April 19 to the last announcement, it's also been going up, right? So April 22, general surveillance positivity rate was 2.46. April 25, 2.44, it came down. April 27, 2.46, same as 22. April 28, 2.71. May 1, 2.72. May 2, 2.98. Which that May 2 correlates with the April 25.
Yeah.
And then, of course, in terms of the 500 extra, then May 4, 2.85. So you see your general positivity rate is trending up for the general surveillance. For your enhanced contact tracing as well, when we started in April 22, it was 1.06. 25th, 1.19. 27th, 1.24. April 28th, 1.47. May 1, 1.50. May 2, 1.71. And surprise, surprise, based on the latest announcement for enhanced contact tracing, your positivity rate is 1.98. It's getting close to 2. Do you follow me? So it depends on what you are looking at, which is why Godfrey's point about let's not say we are at the peak is valuable. But I think, for me, looking at everything, the man was answering a question on Tuesday. Look, if the team working on this knew that we have reached our peak, and they were coming for a press conference on Tuesday, they wouldn't have waited for a question to say it. Do you understand? So what they've done is that the man has gone to justify why he made the point that we're at a peak. It's a certain peak.
And so we have to explain.
But whether it is the ultimate peak that you are looking for is a different issue. Please do follow me. Okay. Because if you are doing a press conference on Tuesday and you've reached the peak of your infections, that will be your lead story. But it wasn't. It was in response to a question. And now they came with a histogram to prove it. We haven't seen it. In fact, even the data in terms of the extra, when somebody asked about data, Kumar just said, look, data, you can ask for it and we'll give it to you. So I don't really think we've gotten to the the part of the infection that we can start relaxing yet. I don't think so. Based on the answer Dr. Kuma Abuaji gave to the question Kojajima asked about the basic reproductive number, which is a very revealing answer. I don't know if you have that audio, but we'll see. So for me, I don't think we are out of the woods at all. I don't think so. At all.
Going forward, knowing all that we know now, the fact that per the Ghana Health Services explanation, we have reached a peak, our peak. Bernard calls it a particular peak. What do we do? Widen the testing net?
Test more. You see, for me, that is what needs to happen. It is only the testing. I can understand the testing is also expensive, but test more. At the moment, I'm looking at total tests carried out. We are at around 130-something thousand, if I'm not mistaken, quite high. Between on the African continent, as we've been saying loudly, it's us and South Africa. South Africa have done 268,064 in all, and we have done 129,461. The numbers I have in front of me could be more. I'm sure it will be slightly higher than this one. We need to find a way of increasing those numbers, especially in the places where then Western North again will become interesting to look out. The Greater Accra will be interesting again. Eastern and the Uti region, interest will be because of the border movement that has been happening there. The good thing about testing for us at this point would be this: as Bernard rightly said, it looks like because of the young majority that we have, we are a bit more resilient in dealing with this. So having high numbers at this point might not necessarily be a bad thing, but it also informs you, see, because you don't want suddenly to be inundated with, oh, where did these deaths come from? Why is it that suddenly 100 people are showing up at the hospital as part of your general surveillance, and you'll be shocked at, oh, why this is happening? So I don't want us to sleep, and I know they won't sleep on this. We need to test a bit more, a lot more, and then once we have a fair idea of where we are, perhaps we can do a bit more.
But I know what is causing the dissonance, and the dissonance was very classic on Tuesday, where your health minister was very desperately telling people to stay home, wear masks, and your advisor to the president was basically saying our mortality rate is lower than most people, so we are doing well. There's a tension there, right? And I've said this before, our case fatality ratio is very low.
Yeah.
Okay. We have 3,000 plus cases. 18 people have died. The average case fatality ratio for Africa is 4%. Our case fatality ratio is 0.7. We are not even 1%.
Yeah.
So our people believe that because we are testing more people, we are getting more asymptomatics, people who don't have any symptom. If we only limited ourselves to the people who are sick, the ratio of the people who are seriously sick among that group will be higher. But because we test more than other people in Africa, a lot of our people are asymptomatic. They are young, they are strong, they don't have any underlying conditions, they are at worst mild sickness, right? So what is giving people like Insiansari confidence? He looks at his case fatality ratio, he's below 1. He looks at the percentage of the people of active cases who are seriously sick. Let's look at the figure. The figure is good for him because he sees for Ghana, right?
Yeah.
He has 3,091 cases, 2,770 active. How many are in critical condition? 5. He looks at that and he says, you know what? It's very good we closed the border early. It's very good we started doing enhanced contact tracing faster than everybody else. We've cleared our backlog. We are on a high. We can manage this thing. Okay? His health minister is like, yes, it's true, but I've seen Singapore. I've seen other places. I don't want Singapore to happen to us, where Ghana is praised and all of a sudden there's a spike in some place and then it becomes a bad problem. So they need to get their act together on what message they want to ride out. I think I prefer the health minister's approach, honestly. He's basically saying, let's make sure that the gains we've made
are not eroded.
I don't have time for political platitudes. That's basically what he said. He didn't say it in the way. He's basically saying, look, the president has said we should do this. He's done a good job. Buy masks for other people. He wants to make sure that whatever we are on our curve, it keeps going down, down, down until he clears the thing by whenever. But because we're also in a very heated political environment where people are criticizing, as I'm speaking to you, the opposition held a press conference today and they said the president is not using the science. So the government guys are, no, we are using the science, we are winning. You see that tension? So I think that whoever is leading this effort should whip everybody into line and say, let's stay on message. Okay, because if you stay on message and you manage, because whatever assumption you have, whatever curve you draw, you and I can spoil it by our behavior.
Yeah.
So if you let them stay on whichever curve they are using, then the politicians start saying things they're not supposed to say, and post having a false sense of confidence. Now they say open churches, open the mosque, open business, because you are saying you are winning. If you are winning, why you close the church? So it's very important for the communication to be clear, and for whoever is leading the communication to make sure that you stay on message at a critical time like this, because majority of our people don't have the formal education and the access to information we have. So if you can't tell them that, oh, Nanado has come, BBI, okay, yeah, we need fight, yeah, better change NDC, then somebody to say, no, stay home, wear mask. You saw the woman, or say, I used to say, maybe corona. These are the reality. So for me, look, of course, I said to me that the person who leads the communication in a public health emergency, the most important person, right? But in Ghana, every day, on average, 7 people come and address us. Is that the best way to do it? Fine, they are experts. Only today, Kojo Opon-Nkrumah spoke. Today was the smallest too. Kosi Yankee spoke, and then Dr. Kuma Abuaji spoke. Probably that should be a model. And Bedusa Akodie 4. 3 days ago, it's like 7 people. Health minister spoke, information minister spoke, then you had the advisor to the president also spoke, then you had a couple of directors of Ghana Health Service coming to speak, one on face mask. Why? What are you doing?
Godfred, has that been a problem in communicating exactly where
everybody.
we are?
Well, I think the strategy has been to give room for the individuals involved in various segments of this to speak. Although, like Bernard said, what is it that maybe the person who is teaching us how to wear a mask will say that Bedusa Akodie, who is the director of public health, cannot see? He can also teach how to wear a mask.
Let one person say,
you can't say that Bedusa Akodie doesn't know how to wear a mask. He's a doctor. You understand? So some of the things, maybe you can compress everything and let one person say it. But it also looks like we are trying to open up. The strategy is also to give up room for persons to be recognized in their areas of endeavor. As to whether now is the time to do that or not, it is not for me to say. But for me, that is what that is how I see it.
Why would you need? Let's look at Tuesday. Your health minister has come to give a message. Information minister is the MC. Your director of public health service has come to speak. Your head of virology has come to also talk about backlog. Then your presidential advisor also comes to say something about our mortality rates and things. Meanwhile, you've had donations and things all going on. Why? We already have information overload. So, look, I know the information minister is a young minister, but he's proven he's very competent. And he clearly understands the communication. So you probably need to choose the scientist for the day, okay? If it's virology, virology. If it's epidemiologist, so you can have your epidemiologist, Bedusa Akodie, your virologist when it has to do with testing issues. The rest of the information minister, your deputy health minister is a scientist as well. But you can't have all this and then you have now somebody from another authority comes to speak. Somebody says wear mask. Somebody says do this. We are
so then sometimes we have Opon-Nkrumah trying to explain it better.
Today, and I'm not saying you shouldn't talk about financial relief. So now they have been talking about bank,
the MBSS
savings and loan. No, they didn't add Mr. Nipa
savings banks and
why?
Because there had been questions.
No, but you see, it's a COVID-19 session. You can do a regular press conference or let Mr. Nipa do a press conference. So you see, do you understand? Because it's a delicate situation we are in, and we can't do business as usual where everybody wants to be recognized for what they are saying. You confuse everybody. You confuse the whole country. That's not what you want to do.
All right, we'll see what happens on Tuesday. There's another press briefing. We understand it's Tuesdays and Thursdays. But one other thing that happened today was the minorities press briefing in Parliament, and the leader Haruna Idrisu, well, for them, government has not been as commendable as many people see, that we are not winning the fight. But one concern they raise is about Ghanaians who are stranded outside the borders, and they think that the government should consider evacuating them.
At this point, what countries have done is basically say that if you are in X country, and you want to travel. X amount of money, register via the embassy, it will bring you home. Look, it looks like we got some information that today they are still doing that, I think, in Jordan and Saudi Arabia.
I think Nigeria too.
As well, to have that conversation. As to whether you have the wherewithal to do it, because it means you have to charter a plane to do that. How many countries are you going to do that? Are you going to decide that, okay, I'm gauging there are 50 Ghanaians in the US who want to come, but there are 10 in Nigeria, so we'll leave the 10 in Nigeria and go for the because there has to be a value for money. You can't charter a plane for $100,000 and go and pick 6 people. Somebody will tell you that doesn't, or the plane goes round and picks people within a certain geographical area. It's logistically it's difficult at the moment to do. Okay, so for me at the moment, I'm not really weighing on the side of let's go and bring people home. So far as it's not a desperate situation at the moment.
I think the more substantive thing the minority said was that government is selling false hope to Ghanaians and is using management of information as a cover-up. Some people think that we need more information to back the optimistic tone that seems to be coming through from the government communicators on this issue. Haruna said, for example, that we are 3,000, you say we should wait, all is well. And to be fair, they didn't say all is well. And of course, I didn't listen to the full, but I don't think Haruna the full said all is well. But his point is that some of the messaging seems to suggest that we are doing well, where the science doesn't seem to agree. And you see, for example, the point I made about basic and effective reproductive number. Okay, if you say you are at a peak on the basis of raw positives for a day, and yet you also admit that your R, whether it's R not or R effective, if it's R effective, it's even worse, it's R 1.9 or 2. That's clear. That clearly doesn't tell you. This is not a situation of a country that's winning a battle against a pandemic. Do you understand? But again, your mortality rate is low, case fatality is low, so government can pick and choose. Look, this is some of the points they are making make sense, but a bit of it's also politics, right? Because you can look at the same data and say that Ghana is doing well, and I've already shown you some of those data points. The 18 people who've died, the low percentage of people who are critically ill. Clearly, they've gotten some things right. Okay, whether they are selling false hope or not, I don't know. That one, I think the politicians can argue for themselves and they can defend themselves well. I certainly think that the government has done some things very right on this point. I think there's a bit of dissonance in the communication. People are too eager to gloat. They shouldn't take the bait. This is a national problem we are facing. Okay, maturity means that someone tells me something, says, don't win the argument, get things done. It's better. You see, because a lot of us in Ghana, we want to win argument. Don't win the argument, get things done. If you get things done, and we can all see that Corona is flat, and you don't need to do any, but we are too quick to want to go and argue over numbers. But when I say something, I'm sure after minority, MPP will come and attack. That's not, when you are leading any organization, you don't spend all your time thinking about winning the argument. You get things done. Because leadership is the discipline of implementing change, not winning arguments.
But do you think the people in other countries should be brought back?
I don't have as much information to make a sensible comment on that issue. Honestly, I don't. Because I heard in the news today or yesterday that Nigeria said they're bringing people back after 2 weeks of deliberation, chartered a plane. Look, Nigeria's Lagos state governor doesn't even know the method of testing we are using. Right? The guy is a great guy. He thinks we are using RDT. He doesn't even know. So my question is, what kind of information are they using to bring those people back? And Nigeria's Lagos state governor is a huge person. For him to go on BBC and make such a big false statement, I don't know who is advising him. So I can't look at what they've done and say, so I don't have as much information to say that they should bring them back or not. What I can say is that if you look at what happened with the Chinese case, later we interviewed the Ghana ambassador of China, he said nobody in China was infected. So sometimes we feel, because of the urgency of the pleas to respond, maturity takes a long, broader view and takes a decision that will be in the long-term benefit of everybody. So that's what I'll say.
Okay, we are wrapping up now. Let me pick some of your messages. Faustina from Takwa writes, Ghana has a COVID-19 time bomb to defuse. Hence, the government must make COVID-19 their top priority ahead of the economy and politics. This is because when the COVID-19 bomb explodes, the economy, politics, education, all that will not be important. Thanks for your message. BB from North Kaneshi, we should not be deceived by the low case fatality rate, high numbers of mild and asymptomatic cases, because it is now concentrated in the cities where majority are young and healthy. If we slack, it gets into the villages where there are older people, you say, we would be doomed like it happened in Italy. We are hoping we don't get there. Finally, a message from Bright. Seriously, the Ghana Health Service is doing more of science of politics than any true science. The regional teams are doing better analysis than the national level, you say. We are wrapping up, Godfred, on that particular
matter. I would have loved it if a bit of autonomy was also granted the regions, because when you look at the breakdown that the regions provide, and they provide it in real time. If they do it today, you get it today. I think would have moved a bit faster, and also there will be a lot more transparency and less questioning of the data. Because if you look at the data sets that the regions provide, obviously those things are sent to the national. So national also has the same set of data. But the sheer depth of the data that is provided at the regional level and the timeliness of it has been really, really important. Unfortunately, we're not allowed to engage with them on that kind of level. We have to wait for the national updates. But, well, it is what it is.
Bernard, your final words.
My friend Theo Champon is an economist based in London. I interviewed him 2 days ago. He said, Bernard, here are my 2 suggestions based on what I've seen in other countries, and I'll use that to end. Have only 3 people speaking at every session, including high-level government officials, and schedule this in advance. 2, let data and visuals do more of the talking. Simple rolling averages, bed capacity, testing capacity, and other metrics. So today, we were supposed to see a graph. The graph was on the TV less than 10 seconds. I don't know whether the cameraman was the one who was making a mistake.
That was the cameraman.
Let the numbers speak for themselves. When you have to explain too much, sometimes it's difficult to believe you. Let's listen to what Theo is saying. I think it will help all of us.
Godfred.
Well, like I said,
we'll just end on that and giving the regions autonomy.
I am with everything Theo said.
Thank you very much. That's Godfred Akoto-Boafo. He heads the current affairs desk here at Citi FM and Citi TV. He was in studio with Bernard Afler, the host of the City Breakfast Show, and The Point of View. My name is Abnanya Mecha Ampedu. I was your host, and we are glad you listened on Citi FM and also watched on Citi TV. Do enjoy the rest of our programs.